for being here. We are very excited to have the latest and newest 3D digital mammography system from FUJIFILM, FUJIFILM Sofinity, available at our NM Medical Car Center. At NM, we have always believed in technology being a leading differentiator in the market. And it's always been our philosophy over the last more than 4 decades that we've been around to adopt the latest and best of technology, whether it be in imaging, whether it be in laboratory testing. And with this new system, we are really bringing in a new era in breast imaging that takes patient comfort, patient experience, image quality, and overall workflow efficiency to a completely different level. We already have a very strong breast imaging and interventions program at NM. With this technology, now we'll move to the next level. We'll be able to detect cancers faster, more accurately. We will make sure the patient has less discomfort, so all the fears of getting a mammogram done then can go away. And it will continue to elevate our status as the leading breast imaging and interventions program in the city of Mumbai. Of course, the other nice thing at NM is after all of the imaging is done, we now have the ability to perform all follow-up laboratory diagnostics as well, whether it be histopathology for a ultrasound guided or a stereotactic biopsy that our breast imaging experts perform, or a molecular genomic test. NM is a one-stop shop for everything when it comes to breast care and breast interventions.
Welcome everyone. Thank you very much for being here. It means a lot to us. We are all aware that breast cancer is the new threat for the women of our country. There was a time when we only knew of somebody very far away who had ever gotten any form of cancer. But today we almost know somebody who has not just had cancer but has been treated for breast cancer. Whether it's in our society, whether it's in our family, or whether it's in our friend circle. So the threat is not too far away. There was a time when breast cancer happened only to older women, but that is not the case anymore. We are seeing breast cancer being diagnosed in young women in their 20s, in their 30s, in their active life, when they have young families and they have a career to toggle. There are mortgages going out, so they can't take time off from work. So in this scenario, it is very important that we increase the awareness about breast health amongst Indian women. That is point one. The second point is, because there is no pain in breast cancer, women often notice it, but they disregard it, saying that after my children's exams are done, I will go to the doctor, or after this important presentation is done, I will go to the doctor. And then in that we lose out on valuable time. So bringing about this awareness that there is no pain in breast cancer and therefore you have to see the doctor and do all the appropriate tests in time becomes very, very crucial. Okay. Having said that, after you reach the doctor also, you want to reach an institution or organization where all the correct testing is done so that the diagnosis is not delayed after that. Okay, a diagnosis of breast cancer involves a mammogram, a breast ultrasound, and a biopsy. Okay, and oftentimes women do not want to come for a mammogram because they perceive that mammogram is painful, and that is the perception we want to change today, because technology is advanced. With FUJIFILM providing us with most advanced mammography units, the discomfort associated with a mammogram is close to nil. Okay, the newer paddles which are available are more malleable, and the structure of the machine has been altered by the feedback from patients, feedback from clinicians, feedback from radiologists, such that it is a more friendly machine. It is not scary, it is not painful. Okay, so we want to get that word out also, that mammography is not painful. So please don't avoid a mammogram, because it is crucial that mammogram be done on time for early detection of breast cancer. Having said that, one of the important things is AI. AI is the newest thing in every field of our life. Now our newest mammography machine is AI guided, which means during positioning, like when we obtain the mammogram, we can only detect what is there on the film, right? Oftentimes when the mammogram is obtained, because the patients are anxious, they move behind. There is a positioning error, there is a cancer there, but it is not included on the mammogram. Those things can be avoided by this newer technology. The FUJIFILM AMULET sophinating machine has AI for positioning in it, so that positioning errors do not happen. The mammogram which is obtained is highest quality and is most optimal. Okay, and that's how it aids the radiologist in proper diagnosis. So that is another advantage of the latest FUJIFILM Sofinity machine, is the AI in positioning. The second advantage of this machine is there is 3D tomosynthesis. What does 3D tomosynthesis mean? All of us are acquainted with a chest X-ray, correct? Everyone knows what a chest X-ray is. Who has not had a chest X-ray in their life? Anybody? Everybody. So we all know, okay? But chest X-ray gives us information only 30%, okay? Because it is a two-dimensional image of a three-dimensional structure. So when the doctor wants more information, what do they ask for? They ask for a CT scan of the lungs, correct? And we saw that during COVID. The doctors were always asking for a CT scan because it is slice by slice by slice imaging. The same technology, the same kind of advancement has been made in mammography. Earlier, the mammograms used to be two-dimensional. The breast used to be compressed and then one film used to be obtained. Now, with the 3D tomosynthesis, it is slice by slice by slice imaging. And that way, our detection improves for breast cancer. Okay, so our detection improves by adding one more technology to the same machine. Patients do not have to run around. Unlike a chest X-ray versus CT scan, patients are running from one machine to the other machine. For a mammogram, that is not true. The 2D mammogram is done on the same machine and in the same compression. Within 7 seconds, the 3D tomosynthesis is done, which is slice by slice imaging, which is another advantage, great advantage for timely detection and diagnosis. And finally, our newest machine also has the ability for contrast enhanced mammography. Now, what is contrast enhanced mammography? Everybody has heard about contrast enhanced MRI. So this is a type of what we call functional imaging, okay? Which means if there is a cancer and we inject a contrast, then that contrast gets pulled exactly in the area of cancer, and it rest of the breast is not nothing else lights up, only the cancer lights up. So imagine the sensitivity, which means cancer detection rate with the contrast enhanced mammography becomes 100%. Now the beauty of this machine is the contrast enhanced mammography is available on the same machine, which means that we inject contrast, we obtain a mammogram. In 10 minutes we know whether we have to worry or not to worry, whether this patient is going to need a biopsy or not need a biopsy. So these are some wonderful technological advances, and at NM Medical we have adopted all those technological advances with one single intent. Our intent is to provide the best healthcare to the women of our city, to the women of our country, because women are the pillars of the family. If a woman is not there, it is not just she who collapses, the entire family collapses. Okay, so she is the main infrastructure, and we understand that, we realize that, and it is a partnership between technology and good medical doctors. So if you have the best of doctors but we are technologically not advanced, we can't do the same thing. If we have the best of technology but we do not have skilled doctors, then we still can't reach the diagnosis. So it is a marriage of it is a good marriage of highest end technology and good medical workers. So there is also one more thing. My husband always says, never give the mic or the stage to Shilpa. Once she starts, she doesn't stop. So I got to stop. If you have any questions, you can ask me later. I should allow Vada-san to speak.
So thank you, ma'am, for sharing your expertise and clinical experience. I would now like to invite Mr. Koji Vada, Managing Director of FUJIFILM India, to address the media and share FUJIFILM commitment towards...
Namaskar. My name is Koji Wada, MD of FUJIFILM India. Warm welcome all distinguished and media friends and our colleagues and respected doctors. So it's a very great honor to be here today. And first of all, I would like to thank you, NM Medical team, Thank you very much, and we always feel proud to work with you, and we are learning a lot and getting energy from your side. Thank you very much. And in 2016, 10 years ago, we have installed first mammography
Yes.
in NM Medical. And today, we are very glad to announce you have installed our newest mammography, the Amulet Sofinity. So that has newest technology and most advanced technology and AI-powered equipment. So I believe that not just equipment with NM Medical, it will care for the patient and empower doctors. And FUJIFILM India doesn't provide only equipment and service, but also we focus on early detection of breast cancer. So we have been promoting many campaigns all over India, and almost 3 years we have completed the campaign. So because our goal is to make every women to realize importance of early detection. And last but not least, India is world's the fastest growing healthcare market globally, and FUJIFILM committed to provide best product and service and overall support for Indian customers. And our corporate purpose is giving our world more smiles. So with partners, we will do our best to give maximum smiles in India. Thank you very much.
Thank you, Gwada-san. Thank you.
About the technological advances between this version and the previous versions, and what is available in India and how comfortable it is. So what is the major differentiating factor in the discomfort that is gone now and there is no pain? So how does this differ? What exactly are the, could you elaborate a little more on the exact reasons for this? And also my next question is about the resolution, and is it a 3D, and if it is 3D, then does it move and does it give a 3D object? How does it display the this thing on a monitor or on a FUJIFILM, I mean a physical film?
Yes, yes. So, as per the feedback of customers, we have 2-3 strong points. The first one is image quality. As always, we are getting feedback from customers. We are trying to make good processing and better images. So each customer. So it depends on the country. It's different, but we are always adjusting best quality for each country. And second one, often the doctor will have from the patient some painful. The mammography is very, very painful. They have some mindset, but we are always making the improve some paddle or the overall pressures. So now patient getting less pain. Of course, by myself I cannot test, but I feel the whole feedback is becoming better and better. And third one, the AI technology, as doctor said, we have now put on the one AI positioning technology, so that will very easy to position, and without some missing the image, we can suggest the best position in our new equipment.
So does the image, is the image 2D or is it the 3D, and is it on film or is it on computer?
May I answer this question?
Yes, please.
Yeah. So to answer the first question, it is 2D and 3D. That is the beauty. It is a combination image. Okay. So 2D means it is a 2-dimensional image of a 3-dimensional structure. So we will see only one image per patient. Okay. And 3D is a misnomer. We are not creating a 3D image. In fact, we are getting slice by slice image. Okay. Think about it like this: if you had a potato, okay, and you just took a photo of that potato from top, you'll just get one image. But if you sliced it, okay, and then you took an image, it opens up, right? It completely opens up, slice by slice by slice. You've opened up, okay, and now you have multiple images of that one potato. So something like that, we get slice by slice by slice imaging, and that's how we can see through between the two slices we can see if there is any small cancer also developing. So that is the answer to your second question. The answer to your third question, is it only on a film or is it on a monitor also? Both. So on the monitor, so that we can interpret those images. These monitors are high resolution monitors, 12 megapixel monitors. That is how high the resolution of these monitors is. So once the image is obtained, highest resolution image is obtained, and on highest resolution monitors we go over those images so that it enables us to find not just cancers but pre-cancers, which means even before a cancer develops, we can see those tiny microcalcifications which are micro, less than a centimeter also in size, which are seen on those monitors. Now, why do we give films if there are monitors available? So that the clinician, the referring physician, the referring surgeon knows exactly what we are talking about. Like, okay, we found this cancer, this is the spot where the cancer is, and this is where we did our biopsy from, and this is the image to support or give evidence of our findings.
Great. And when you say talk about the images, multiple images, how many images on an average are taken in a?
That's a very good question. That really depends on the patient's body constitution. There are some patients who are petite, who are small, who will have say about 30 images per scan. And there are some patients who are a little bit larger. They may even have a few hundred images per scan. So it really depends on the body constitution of the patient.
And could you elaborate a little more on the discomfort part for the patient?
That's I was just sharing this experience with my boss, Mr. Rahil Shah and Vada-san. I had a patient this morning, a 49-year-old. The correct age for starting screening, screening mammogram, is 40. We recommend every healthy woman above the age of 40 should come for a mammogram from the age of 40 years. This lady was 49. She had taken a day off from work, and then she had come for her screening. But she said, I only want an ultrasound. I don't want a mammogram because mammograms are painful. Okay? And I asked her when she did her last mammogram. And she said, before COVID. Since COVID, I haven't done my mammogram because, you know what, I'm afraid of the pain. So I said, now you take my word and you understand that we have the latest mammography equipment. Okay? And these equipments are made based on feedback from patients and doctors. You go down, have the mammogram, just have one view, only one side. If it is painful, you come back to me and I will not ask you to do any more views. Okay? But if you think it is not painful, do the full mammogram. 10 minutes later, she came back. She had done the full mammogram and she said, Doctor, it was sweet. Okay? Sweet is the word she used. It was sweet. It was not painful. My previous experience was completely different, but this time it was not painful. And I said, you know what the company calls this paddle? It calls it a sweet paddle. Now you imagine, in the olden days, this paddle, there is a detector down here, and then there is a paddle which comes down and it compresses the breast. In the olden days, this paddle used to be made of hard plastic. Imagine that. And now there are so many forms of acrylic available. They use the best form of malleable acrylic, which means when it compresses also, it does not come straight like that. It starts to bend a little bit. So that makes it a little bit more comfortable. In addition to that, the company has made the design of the equipment in such a way that on the detector, the lower part, say initially it used to be straight like that. Now they have made a little bit indentation. It's a circle aa gaya hai aage. So that when patients are positioned, the abdomen comes in the front and then it gets painful, they can't bend and it's an awkward position. So that has also been overcome. So the biotechnology side of the company, FUJIFILM, is our partner in this. The R&D, they're constantly working on our feedback and every little feedback we give. But the winner is the patient in the end, right? Because something which is so important in today's day and age, breast cancer, the incidence is out of the world in India. India is 10 years ago when we started our practice here, 13 years ago, cervical cancer was the top killer of Indian women. Today, cervical cancer is down. It is breast cancer, okay? And there are many different reasons for that. We are not going into the reasons, but what we need to understand is we need to get the mammograms done. And pain cannot be a reason. Pain means what? It's not pain. These are women who have had children, gone through 10 hours of labor, but they have this misconception that mammography pain hota hai. ये नहीं होना चाहिए. Okay, it is just compression, gentle compression for no more than 7 seconds. Can you believe it? और वो 7 seconds से की डर की वजह से औरतें mammograph नहीं करवा रही. ये नहीं होना चाहिए. So that's the answer to the second
What's
question.
your message to the women of India? What age should they start? You just mentioned 40.
Yeah.
After how many years must you do the mammogram, and how expensive it is, a normal mammogram and a FUJIFILM mammogram?
Okay, I'll answer all three questions. Okay, so like I feel like going in reverse direction. How expensive it is? What is the value for human life? Is the question I would like to ask. You know, today's day and age, we go home, we order on Swiggy like this. Okay, बहुत थक गए आज खाना order करते हैं, and our Swiggy order is never less than 2,000-3,000 rupees. Okay, but when it is a question of doing a mammogram, you're like, oh my God, 5-6 हज़ार अभी मैं कहाँ खर्च करूँ? Okay, and that 5-6,000 you're going to be spending say once a year or once in 2 years. What is the value of your life? What is the value of your wife's life? What is the value of your mother's life? Is the question you want to ask yourself. Okay, that is point one. Point two is when should a woman start doing a mammogram? It is not what I am recommending, or it is not what should be done in India. It is global. The world recognizes there are bodies out there, the American College of Radiology, American Cancer Society, the European Cancer Society, the Canadian Association, all the countries where there are screening programs. There, mammogram screening starts at the age of 40. Why 40? 40 is not a magic number. But beyond the age of 40, the incidence of cancer starts increasing. Breast cancer, the incidence starts increasing. Therefore, 40 is the recommended age. What should be the interval? In the ideal world, the interval should be once a year. But there are public healthcare systems. Like, you know, Canada is a public healthcare system. Government paise deti hai. Then in US there is insurance-based system. So there they do cost cutting as per their requirements once in 2 years. But even in Canada today, between the age of 40 to 50, they do mammogram once a year. In US, where the patients are paying through their insurance, they do mammogram once a year. And the reason being, God forbid, a woman has a mammogram today. 6 months later, a cancer starts developing, and she decides that I will go for my mammogram once in 2 years or once in 3 years. Then the entire purpose is defeated, right? We want to catch cancers early. And let's understand the reason why we want to catch cancers early. When a cancer is detected at less than 2 centimeters, while it has not spread to the axillary lymph nodes, then the treatment required for that breast cancer is lumpectomy, which means only that cancer is removed, and then they give radiation therapy. Most of these patients do not require chemotherapy. Most of these patients do not require their breast to be removed. Okay, the treatment literally ends in 1 month. एक महीने में treatment खत्म हो जाता है. 1 day for operation and say another 20 days for radiation. When the patient waits too long, the cancer becomes like a 5 centimeter tumor with lymph nodes in the underarm. Patient requires chemotherapy. How much chemotherapy depends on what subtype of cancer. Every breast cancer is not the same. Some are more aggressive, some are less aggressive. Some are the ones which are going to respond to chemotherapy, some are the ones which may or may not respond to chemotherapy. And if you ask any patient what was the hardest part of the treatment, they will always say, Doctor, chemotherapy was the hardest part of the treatment. Okay. After all this chemotherapy is done, she may also require a mastectomy, which means the breast, it has to be removed. She may also require axillary lymph node dissection. Lymph nodes in the underarm are removed. You know what is the consequence of that? Edema. The एक arm हमेशा के लिए सूजा हुआ रहता है. Okay. These patients will come back and say, Doctor, I am cancer free, but I did not get my life back because I can't even fold my own clothes. ऊपर से अगर कुछ निकालना है तो everything is stiff here. Okay, so what is the purpose? Like, you know, the purpose is early detection, and that early detection can happen if the woman has an annual screening mammogram once a year. So coming back to the question that you asked, after the age of 40, once a year up to the age of 75. That should be the recommendation. Sometimes women find it very hard to come once a year, and then I say at least come once in 2 years. When should I come, doctor? So earlier I used to say come in the month of your birthday. Give yourself the gift of a health checkup so that you remember that this I'm doing for myself, this I'm doing for my family. If I'm healthy, I'll be able to take care of my family very well. If you think that for my birthday it is too stressful to come for a mammogram, then do it in the month of December, because then that way you give yourself the gift of good health for the next new year. Okay, those are the landmarks we don't forget, your birthdays and New Year's. Okay, so give yourself a gift of a good health checkup at a good organization, good institution. Now, there is one question you haven't asked me, but I will still answer it. In India, more and more younger women are getting diagnosed with breast cancer, women under the age of 40. And those are the women we are not screening with a mammogram. But for those women, we are recommending that from the age of 20 onwards, we should make every girl aware about self-breast examination, about what are the signs of breast cancer. There is no pain in breast cancer, so women don't realize only until it is too late. And even if a daughter goes to her mother saying that I have a lump in the breast, the mother will land up saying, what are you talking about? It must be hormonal. Period के बाद चला जाएगा. कहीं नहीं जाता वो lump, क्योंकि वो cancer का होता है. But in that they have lost on good time, and no mother wishes this on her daughter. But lack of knowledge, lack of awareness is what brings families into these situations, and we see this day in and day out. We do not want this for our families. We do not want this for anyone. So awareness, painless palpable lump, nipple inversion, spontaneous bleeding or watery discharge from the nipple, these are the top signs. If these happen, you have to go to the doctor immediately. But how will you know that you have this? You will only know if you're in the habit of checking your own breast every month, once a month after the period is done, if you're in the habit of checking your breast, or once a year go to your doctor and get it checked till the age of 40. So that is our current recommendation. Awareness has to be increased, self-breast examination has to be taught, and yearly mammogram after the age of 40 is important. And that's the only way we are going to detect these cancers early and provide good health to the women of our country.
Ma'am, still, what will be your message?
Yeah, हमें ये mindset change करना है that I am invincible, I am a superwoman. Everyone is a superwoman, but more than a superwoman, she is a very busy woman. Either she is busy with her college, her academics, her career, her young family. बच्चे होते हैं घर में, you know, in-laws होते हैं, family की responsibilities होती है. Between all these responsibilities, there is no time, but you have to make that time. That mindset has to come that if I am okay, my family is going to be okay. If I am okay, then I'll be able to work and do something good, worthwhile for my family, for my country, for everyone around me. Yeah, that mindset has to change.
I want to add something here. One of the ways to address this challenge of getting your tests done routinely every year and getting the right knowledge in terms of self-breast examination or what you can do proactively to reduce your risk is coming in for an annual health checkup. Now, we are lucky at NM, we have a lot of clients who come year after year for a complete full body health check. That takes care of A, all of the tests being covered including a mammogram, B, at a reasonable cost because then all these tests get bundled together in a package. So you are paying far less than what you would pay individually for each of the tests. And C, in these health checkups, you get to interact with a gynecologist or a physician who would tell you about the need for a self-breast exam. You would get to meet someone like Dr. Shilpa Lad who can tell you how to manage some of your risks more proactively. So again, just generally spreading the awareness about the importance of getting a comprehensive annual health check which combines both your pathology tests and your radiology tests is an important message. We have many companies with whom we work where the company pays for an annual health check for their employees. They come in once a year and get all the tests done including a mammogram. What we would hope for is better utilization of this, right? Many companies have this available to their employees, but utilization rate is still only about 25-30% of the total eligible employee pool. So when that utilization rate improves, automatically some of these issues would be taken care of.
Sir, HR manager or HR team or admin team, do you facilitate it, make it compulsory to go for annual health checkup?
So from our end, we are always happy to push them to get it done regularly. I know now more and more companies are making it part of their annual appraisal plan, that the health checkup has to be completed to be eligible for an annual appraisal. So measures like this are coming into place, but at the end of the day, company HR, when we interact with them, tell us we can push employees, we can create awareness, NM can participate in spreading that awareness, but beyond a certain point, they can't force someone really to come in for their test. So it's more of a mindset change. Today, the corporate employee, like Dr. Shilpala had said, is busy at work, long work hours. then they want to spend time with family, then they want to travel, take holidays. So in between all of that, that health checkup somehow gets forgotten. And when there is more mainstream awareness of the importance of getting that health check through media, through articles, through videos, what people consume now in the digital era online, that is when there may be a greater motivation to utilize that benefit. Ultimately, the employee is paying nothing from the pocket, company is paying for it, and yet the utilization remains low, which is unfortunate.
Is the facility available only available in this hospital?
At NM, yeah, health checkups are available here. Mammography. Yes, it is available at NM and at a few NMs. So we have about 18 centers across the city. Of the 18 centers, 4 have FUJIFILM unit. This, the one at Khar is the most premium, the latest launch with the highest in technology. But just one step below this are available at 3 of our other centers.
This system here is India's first. So there is only one in the whole country, the one that has been installed here.
And again, cost-wise, I'll ask, what will the cost for one sitting?
As Dr. Shilpal had said, it's in the 5,000 to 6,000 rupee range, which includes the mammogram plus a breast ultrasound and a consultation with Dr. Shilpal.
Yeah. So
Will there be any
mammogram.
special offers like for coming and getting it done?
So special offers like Women's Day offers etc. we have, and I was just saying, like speaking पे तो हम कभी offer नहीं मांगते, but
Because still there is a fear in the mind of a woman, like मैं क्यों जाऊँ, like मुझे कुछ हुआ ही नहीं है, या फिर
No, so through their companies, through some medical associations that we work with, some social organizations that we work with, some oncology clinics, I wouldn't like to name any, but they are, as part of their CSR trying to reach out to a wider segment of women. We subsidize the cost in all these types. So it becomes far less than what one pays, out of pocket when you walk in here. So those are available through the year in different forms. But I don't think affordability is what holds women back in Bombay from getting a mammogram done.
Yeah.
It's really the lack of awareness, the myths around discomfort or pain, and the fear of the unknown. Right? So if we can address this with better messaging, then I'm sure utilization rates will improve.
How you're doing awareness to for people, like people should know that NM has this facility. Apart from us,
Yeah.
apart from that, what are the other ways of you doing it?
Spreading awareness, like in partnership with Fujifilm, we do public health awareness campaigns. Plus, we do something called skill labs. We train the trainers.
Have you done before, or you'll be planning to do it?
We do many over the
No,
last
because the first
13
time
years.
you said you have installed this machine over here.
The first time, this is the latest version.
Yeah.
We have had this machine for the last 10 years.
Okay.
The previous model.
The previous
previous
model
model.
has been here for the last 10 years. And even before that, NM has been doing mammographies. The advanced technology mammography is what we got 10 years ago, and this is the most advanced, which we just got. Okay, so this a technology with the most advancements is now available at NM. About awareness, we have been doing awareness campaigns over the years. From NM, with NM, in collaboration with others like Rotary clubs, etc. We keep doing this. We keep then through organizations just like Jeevan Vidya on bigger platforms where we speak to general public about this. All this is constantly going on,
Can you
constantly
share
happening.
one success story of this
Of the patients,
patient? Any success story?
there are many. Yesterday we had a program at for education, and there we had 3 of our survivors who came, and it is a very touching story. This is a 24-year-old who came to me during COVID times. Okay, it was the COVID year 2020. Okay, and this girl comes to me with her mother. Her mother tells me that she's feeling a lump. She's going for her master's in September. So we just want to make sure everything is okay. As soon as I keep the probe, I realize that, this looks like a cancer, but she's only 24. We get the mammogram done, we do the biopsy, the diagnosis is indeed cancer. Okay. Now this brave girl, she goes through her entire treatment for that 1 year. She defers her masters for 1 year, and she informs the university that I will come next year. So she decides to go in the year 2022. Okay. Just before she's about to leave for her masters to Toronto, her mother gets diagnosed with breast cancer. Okay. And this is a family like you and me. like anybody of us, like mother, father, they both work, there are 2 children in the family, and the girl says that I don't want to go, I want to be here for you, mother. And the mother says that you don't have to stay here for me, but I want you to pursue your career for yourself. Her treatment had just gotten over, she was still doing her hormone treatment and immunotherapy, which means she was going to do part of her extended treatment overseas. The girl left 4 days before her mother's operation happened. But her mother's operation happened. The mother and daughter, both of them came yesterday to share their positive experience, that with a little pragmatism, with acting, taking all the decisions on time and staying positive, the mother and daughter both were able to defeat this breast cancer and live a normal, healthy life.
And there,
Exactly what I explained earlier. If the cancer is diagnosed early, the treatment may end in 1 month, which means the patient may just require a small little surgery and 20 cycles of radiation. But if the cancer is diagnosed late, what we call stage 3, then the treatment may take a year and more than a year. And the outcome also depends on what is the subtype of the cancer. In early stage breast cancer, 5-year disease-free survival, as we call it, is as high as 100%, 98 to 100%, which means at the end of 5 years, at the end of 10 years, the patient will be hale and hearty. But with advanced stage breast cancer, stage 3 breast cancers, the 5-year disease-free survival ranges between 20 to 80%. So take an average 50%. 50% of the women die at the end of 5 years because they were diagnosed late. They don't respond to treatment because they were diagnosed late. So that can be changed. That outcome for our women can be changed by diagnosing early.
Sir, how happy you are to put a machine over here, the first in India? What do you have to say for that?
Yeah, of course. And today we already shoot a good photo with doctor and.
So is that been change in process? Is it very change for we Indians for with your latest technology?
Yeah, the process itself is not so much change, but as doctor already shared, some new functions really support.
Additional functions.
Yes. Yes.
Thank you.
मसल्स से कभी फाइब्रोसिस फाइब्रॉइड या कभी कभी मसल्स में हो जाता है क्योंकि वो ओवरवर्क गर्ल्स करते हैं तो ये कैसे वो एग्जाम करेंगी ये पहला पूछना है। सेकंड ये पूछना है तो कितनी एक्यूरेसी है कि वो फुजीफिल्म्स का जो आपका इक्विपमेंट्स है वो कैंसर सेल को डिटेक्ट कितने % एक्यूरेट करता है।
दोनों भी आपके सवाल बहुत ही अच्छे सवाल है। So to answer your first question, your question is how many of the palpable lumps indeed are cancerous?
Yeah.
The answer to that question is 20%. If we put all the age groups together from 20 years to say 90 years, if we put all women of all age groups together, then and if we put all women presenting with new onset palpable lumps, 20% of them turn out to be cancerous, 80% of them turn out to be benign. It could be a cyst, it could be a fibroadenoma, it could be just normal breast tissue. But just by palpating, just by feeling, no woman can ever tell. For that matter, even no doctor can ever tell whether what we are palpating is cancerous or not cancerous. And therefore, that investigation is required in the form of a mammogram, 3D tomosynthesis, breast ultrasound. Okay. Now, to answer your second question, how accurate is mammography in detection of breast cancer? If we put all the densities, every density of the breast is not the same. Some breasts are fatty, some are more dense. Okay, so if we put all the densities together with the newer technology, the sensitivity of mammography goes as high as 80 to 90%, which means 90% of the times the mammogram with advanced technologies like 3D tomosynthesis will be able to detect breast cancer. But about 10 to 20% of the times on a mammogram we may not be able to detect a breast cancer simply because the breast is very dense. It is not a problem of the machinery, it is an issue with the patient's body constitution. Okay, and therefore we add tests to it, like we will do a breast ultrasound along with it, or sometimes we may ask for a MRI along with it. Okay, so those added tests are done to make sure that the lump that we are dealing with is definitely not cancerous. And the final way to diagnose any cancer, any breast lump, is to do a biopsy. So on imaging, on mammography, on 3D tomosynthesis, on breast ultrasound, if we find anything suspicious, then a biopsy is performed to confirm the diagnosis of cancer. मतलब ये तो general knowledge सबको होता है ना, गांठ है तो गांठ की biopsy करनी होती है. So that is the final diagnosis. Yeah.
Thank you.